So I want to introduce Ryan Noel. Ryan joined PSM in April 2023 after transitioning from his thriving private practice in Vermont. Earned his PsyD from the Wright Institute in Berkeley, California, and completed his pre-doctoral internship at Towson University Counseling Center. Ryan also completed a multi-year program in social and comparative analysis in education with a concentration in women, gender, and sexuality studies. Ryan is a dedicated psychologist and has received high praise from clients, supervisees, administrative staff, and colleagues for his compassionate approach to relationships and to life. Welcome, Ryan.
Oh, thank you, Andrea. I didn't know I would be having such a opening. Um, well, welcome everyone. It's really great to see that folks are able to join. And let me just express my gratitude for everyone joining in today. I know for myself that this tends to be a very busy time of year, both clinically, personally, environmentally. And you all do really hard work. And so taking the time to kind of show up to take in more information, especially when it's on a topic such as like the experiences of children and youth in the foster care system, um, really means a lot. So thank you for, again, joining in and showing up. And with that, also, you do you and do what you need to do to kind of like titrate and take care of yourself. So please eat, go off camera, take breaks, whatever it may be. So today, my talk that I've put together is going to be centered around the experiences of youth who are in the foster care system. And luckily, I looked at my presentation right before joining in because I thought I caught most of my typos. I'm sure there will be some, but I left the E off of Maine. And so that would have been quite interesting. Different kind of Maine. I don't know how that would end up being possessive, but it's okay. So just starting off, I have no conflicts of interest to disclose. Easy enough. So our learning objectives today, let me just go to speaker view so I can see better. There we go. So objectives today are going to be just to gain a little bit of understanding around the foster care system, discussing kind of the psychological or the kind of demographics and experiences that youth in foster care experience, and kind of just briefly exploring what psychology's role could be in this experience in the foster care system. These are very idealistic and large learning objectives that I put together, which if you gave me a 16-week course, I'm pretty sure I could then get to, but within a 45 to 50-minute talk, these are really lofty. And so my hope really is that this is going to be an informative presentation that's going to bring awareness or reinforce your pre-existing knowledge around the lives of youth who have been in the foster care system. So outline, I'm going to go over some current events in the realm of child welfare and foster care that is going to be centered around things occurring here in Maine. An overview of foster care, so talking about the structure, definitions, purpose, and then really quite a bit of time on demographics, because I think what we can get is we can get a lot from that, and we can get an image of what it is like for youth who are in foster care right now and how we as psychologists or mental health professionals can play a role in this. And then a brief exploration of like psychologists' potential role in the foster care system. But I love stories and I often talk in story. And so first you get a nice short story. So we're starting off around 2007. For me, that doesn't feel all that terribly long ago. Um, at this time, I'm in a different field. I'm studying social and comparative analysis in education, which is really the study of social issues and the role of systems in maintaining or promoting social maintaining social issues, specifically the role of education and schooling in maintaining or changing social issues is kind of where I'm dedicating my time, and in a different career trajectory. And at this time, I'm doing interviews with lesbian and gay K through 12 educators in a rural setting, and interviewing them and asking them about how do they navigate identity in a heteronormative environment. How do they show up to these settings, um, and balance their identity as an educator and their identity as lesbian or gay? And I'm comparing this to lesbian and gay educators in urban environments and interviewing them too, and making the comparison between rural and urban, and the comparison between parts of the country in which were no legal employment protections around sexuality, and some localities in which there was some legal protection around sexuality. Um, and at the same time, since I can't just do one thing at once, I'm like, who else is kind of like navigating these really difficult complexities around identity? And in 2017, in the field of psychology, Jeffrey Arnett is really defining and putting more materials out there around what he was calling and continues to call a developmental period of emerging adulthood. And so, first started publishing things around that probably around 1999. And by 2007, we're all kind of hearing about, um, this newly thought of developmental period called emerging adulthood from the period of 18 to 29 that is marked by ongoing familial support where youth are continuing to like kind of stay at home or delay working or delay moving on to further independence without the support of caregivers or primary supports. And so it kind of made me think of like, well, like, then what are, like who's being left out in this, and what are maybe like youth who are emancipating from foster care, how do they make sense of this period of time in which we see more and more young people having this extended developmental period when their care ends at 18 or 21 years old? And so I started getting really interested in this topic, and I started interviewing um, youth who were exiting foster care. This is also a unique time because in 1999, and I'll cover this a little bit later, we had the implementation of the John Chafee Act, which passed federally, allowing states to extend foster care beyond 18 to the ages of potentially 23, and that there would be federal funding for this, but it was left open to states. And so by 2007, we were starting to have comparative data on the outcomes of foster youth in states that extended care to 21 or 23 and states who still ended care at the age of 18. Um, and so it was interesting to kind of see, the impact of all of this and kind of think through it. And so I started kind of at this time delving into the things around foster care. And I found were some commonalities of that a lot of information coming out around the experiences of youth in foster care in the early 2000s was reflections on stories that were being revealed from the 1980s and 1990s of the experiences of youth in foster care, in which there were being widely published stories about youth who, due to a lack of appropriate placements, were placed in juvenile detention centers for care. That youth were experiencing a high number of placements, and that, this was something that has been hidden and not known about. And a lot of publications on foster care at that time were calling it America's hidden problem, or that this is something that has been going on for a long time but isn't widely visible. And so seeing that as a common theme, and kind of nowadays thinking about how that may still kind of be, the experience or issues around foster care are still kind of something that is hidden and not largely seen. The other common theme coming out of all of that work at the time was not only hidden, but this was something to feel shameful about. So, of course, we have a dog with the cone of shame on. Um, that there was something to be shameful about in how youth in foster care or youth involved in the child welfare system were being attended to or taken care of, and that this has been problematic, and needs to be addressed. Um, uh, and so then out of that, what we saw was kind of, a period of looking towards the expansion of services, um, and extending, the supports and care that could be available to foster youth. And so these were interesting things for me to reflect on, that, the start of my journey in 2017 was a discovery that, this was starting to get attended to, that there was a lot of data being collected around how, youth were being impacted by the foster care system and their experiences exiting it, and that maybe more attention needs to be applied, that this was a hidden issue, that for some reason, while being public because it's a governmental service, was something that wasn't widely attended to or talked about, that it was, something to collectively maybe feel shame around, and that there was this renewed energy and hope for changing the way things are, and extending services or thinking more creatively around this, around how can we as a population better attend to the children who are in the foster care system. And now looking kind of at this presentation and thinking about where have we come in a little less than 20 years or so. So diving into some recent news headlines that I've collected for this presentation that give us an idea of how foster care is being talked about right now, and kind of what is the current events. So here we have, in just November 27th, a news article on Maine's embattled child welfare director resigns. So this resignation comes after lawmakers scrutinized his leadership over the past 2 years, that there is a renewed attention to the experiences of caseworkers who were brought to publicly testify, and they talked about their lack of support from upper management and other problems within Maine's own child welfare system. And that even the department's own federally mandated report released in September indicated that despite investments and changes within the office, the state was getting worse at preventing children from being repeatedly abused and neglected. So not a good situation. We certainly wouldn't want things to be getting worse. And so in September 27th, so earlier in the year, The Biden-Harris administration announced new actions to support children and families in foster care. And so these executive orders introduced 3 landmark regulations to strengthen services and supports for children and families in the child welfare system. The 3 main focuses here were 1, to support kinship caregivers. So family members and loved ones who step forward to care for a child in foster care, by making it easier for them to access resources and financial assistance. Kinship care is one of the ways that we can maintain consistency in relationships for youth. And if available and appropriate, it is a desirable option often for youth. So the second order is to protect LGBTQI plus youth in foster care from abuse and mistreatment and assure that they have the services they need to thrive. This is currently being challenged by the attorneys general of Alabama, Alaska, Arkansas, Georgia, Idaho, Indiana, Iowa, Kentucky, Louisiana, Mississippi, Missouri, Montana, Nebraska, Ohio, South Carolina, Tennessee, Texas, Virginia, and West Virginia. So we can see that a lot of states are challenging this executive order to increase services that are meant to protect LGBTQI plus youth in foster care system. And the third executive order is to expand access to legal services for children and families at risk of entering or in the child welfare system. And so, the current administration recognized that there are concerns and a history of concerns in these 3 important areas, and have made attempts to expand services and resources in these areas. The executive order, though, however, around LGBTQ youth is being held up and challenged. So another recent headline, just November 28th, Maine expects to have 265 million budget surplus over 2 years. And the assistant House Minority Leader, Amy, said that she would support increased spending to address mental health issues and the child's welfare system. This is good news for addressing the mental health and child protection issues we've all been made aware of recently. And so referencing the recent Lewiston gunman's mental health problems, and I believe new spending should focus on these things. And so very important that if there is going to be a renewed interest, renewed dedication to providing resources, making sure that in that there is the appropriate kind of knowledge, information, and expertise in being able to apply these resources. And so an area in which I think we all as psychologists could have a certain amount of input and say. Okay, so I got a few of these. So November 29th, child welfare caseworkers continue to report deteriorating situation. And this is here again in Maine. So child welfare caseworkers continue to say that they are overburdened and that the situation in the department is deteriorating. The Government Oversight Committee has been asking frontline caseworkers to share their experiences as lawmakers, investigate the state's involvement in the lives of 4 children who died of abuse in 2021. And the director of the Office of the Program Evaluation and Government Accountability that's leading the investigation said that lawmakers often hear that caseworkers should manage no more than a dozen cases at a time. But that he had received a call this week from one worker currently handling 30 cases, but who had as many as 40 at a time last year, while another worker said they were juggling 39 cases. So we're already kind of putting together this imagery of an overburdened, overtaxed, under maybe resourced system in which frontline caseworkers are taking on more and more work and likely perhaps facing things such as burnout and maybe leaving the work or not being able to do the kind of work that they would like to do. And we can start to kind of imagine what the impact this may be having, not only on the folks who do the work, but also the youth who are in care. My news stories don't get any happier. So December 7th, Maine's child welfare leaders admit to persistent problems under grilling from lawmakers. So this reveals more that in recent months, the administration of Governor Janet Mills has pointed to progress in staffing and training when confronted with trouble in the system. However, advocates dinged the department earlier this spring when it responded to Maine having the nation's highest maltreatment rate by citing a broad definition of maltreatment. Another thing that was revealed, child welfare reforms are not keeping pace with persistent problems and new challenges facing Maine children and families, such as the epidemic of substance use disorders and economic instability precipitated by the high cost and a difficult economy for many. And then in 2021, at least 34 children in Maine, the most on record, died in tracked incidents that were associated with abuse or neglect or had occurred after a history of family involvement in the child welfare system, according to uploaded data. Last year, DHHS reported at least 31 child fatalities, with 16 deaths reported so far in 2023. DHSS is reviewing all concerns from various caseworkers who have come before the Oversight Committee in recent months to share struggles over grueling hours, low morale, and lack of support from higher ups. So expanding out a little bit more nationally. So August 8th, study reveals foster children are 4 times more likely to get psychotropic drugs than non-foster children. So the Citizens Commission on Human Rights says a recent study published in the Journal of Child and Adolescent Psychopharmacology has unveiled the high prevalence of psychotropic drug usage among foster children. The study published in May 2023 shows that more than 1/3, 35% of children in foster care system who are covered by Medicaid are prescribed psychotropic drugs. This is 4 times higher than the 8% of non-foster youth under the same Medicaid coverage who receive such prescriptions. Unfortunately, this is not new because there had been public outcry over the psychotropic drugging of foster care children for years. As far back as 2011, the U.S. Government Accountability Office conducted evaluations in 5 states, Florida, Massachusetts, Michigan, Oregon, and Texas, and found that foster children were prescribed psychotropic drugs 2.7 to 4.5 times more often than non-foster children in Medicaid. Many were subjected to cocktails of psychotropics, and the GAO explained that no evidence supports the use of 5 or more psychotropic drugs in adults or children, yet hundreds of both foster and non-foster children in the 5 states had such a drug regimen. I had actually reviewed that GAO study at the time in 2011 and had provided a presentation on that time about psychotropic drug use with foster youth. And that the result of kind of that study had come out that, like, compared with youth who qualify for Medicaid because of a disability of low income, because of a disability or low income, youth in foster care were also more likely to receive antipsychotics at the same time as other medications, and for longer periods and higher doses, despite the lack of evidence to support such regimens. And so it was a little bit disheartening to see this news article and see that since 2011, when there was this really robust study that did an evaluation of Medicaid records, that we still see, this high rate. And then the last thing coming out is like the report flagged that 67% of these are charts that they're reviewing, of those being prescribed the drugs as problematic cases, including prescriptions for kids who are too young and prescriptions for the wrong dose, or as a wrong treatment. And so, if the case files are getting pulled, having, a review of 60%, 67% of these being problematic cases is definitely not a good thing. So moving on, outside of kind of the most recent news articles, which I hope give you some imagery of what the situation is right now, and how things are looking, and kind of some of the problems before us, and maybe starting to think about how we as mental health professionals and psychologists can apply our expertise to these kinds of problems, and especially in renewed efforts or ongoing efforts to kind of address them. So moving on to some definitions and purpose of foster care to kind of just give us a little bit of a grounding of what these things are and what we're talking about, is that so child welfare services is a continuum of services designed to protect children, strengthen families to care for their children, and promote permanency when children cannot remain with or return to their families. Services should be family-centered, strengths-based, and respectful of the family's culture, values, beliefs, and needs. And so when we speak of child welfare services, we're covering the whole entire gamut of the child welfare system. But more specifically, talking about foster care. So foster care is a 24-hour substitute care for children placed away from their parents or guardians, and for whom the state agency has placement and care responsibility. So foster care is really when, the state is taking on the responsibility for kids and youth. This includes, but is not limited to, placements in foster family homes, foster homes of relatives, which is what we call kinship care, group homes, emergency shelters, residential facilities, childcare institutions, and pre-adoptive homes. The main thing, though, to keep in mind is that the state agency still retains, while children are in these experiences, retains the responsibility for that child. And then kinship foster care, which I've already talked about a little bit, which is an arrangement that can occur when a public child welfare agency has legal custody and places a child with relatives or kin in a foster care arrangement. This type of arrangement is often referred to as either formal or public kinship care. Kinship foster homes may be either licensed or unlicensed, depending on the state licensing requirements and family preferences. And so there's been, a lot of movement towards and support for providing more support and resources for kinship care in an effort to kind of counteract the disruption in children's relationships, and being able to maintain them within kind of a network of people that they may already be familiar with, or have more connection with, as opposed to perhaps severing those relationships and moving children into environments that are quite different for them, or they don't have a connection to. And so, as we know from our profession, that the continuance of relationships, and building those relationships can really contribute to resiliency. So further on the purpose of foster care. So children enter foster care because they or their families are in crisis. Oftentimes, these children, who range in age from newborns to teens, have experienced unsafe conditions, abuse, neglect, or have parents who are unable to care for them. As a result, these children are removed from their parents' care. But the key goal of foster care is to ensure that kids are living in stable, lifelong families. So foster care is meant to be a temporary solution that ends once a parent can get their life back on track, or a relative guardian or adoptive family agrees to raise the child involved. And so foster care is meant to be an immediate and temporary space while things are hopefully getting worked on and we're finding a more safe, stable, and secure environment for these children for the long term. Children often come to the attention of a child welfare agency via reports of child abuse or neglect, in which social workers investigate those allegations. And if the child's current living situation is deemed unsafe, the agency must obtain a judge's approval to remove the child in question from their current living situation. And so we all know about our role and obligation as mandated reporters. And then that, those reports are very crucial and needed for folks in these capacities to be able to make the most appropriate and well-informed decisions for the youth involved. So the more we're able to collaborate, the more we're able to provide information. So just touching upon the foster care system more widely in the United States, and how is foster care managed and governed at the federal level. So in the United States, local and state agencies manage child welfare issues and foster care cases. This doesn't mean that the federal government doesn't have a role, it's just different. But just knowing that since the specifics of how child welfare issues and foster care is managed is left up to local and state agencies, this contributes to there being significantly different experiences that kids and families in foster care have nationwide. And so I already gave an example of that, of how the federal government may provide funds for certain services, but it's up to the states as to whether they would like to implement those services or not. And then we can see that from one state to the next, we may have youth who have access to very different services and different then opportunities too. So under the federal government, we have the Children's Bureau, which is an office of the Administration of Child and Family. So the Children's Bureau is what manages legislative efforts and data collection on children in the foster care system at the federal level. And they provide funding to the states and tribes to provide safe foster care placements for children and youth who cannot remain in their homes. And so the federal government's job really here is to provide the funding to the states. And then they also implement the following foster care programs. So the Title 4E foster care program, really what that is that's the legislative title that each provides the budget and financial supports to the states. And then that budget is agreed upon and distributed. And then I had mentioned in 1999, we had the passage of the John Chafee Foster Care Program for successful transition to adulthood. And so this was the federal effort at increasing services for youth in foster care under certain circumstances to the age of 23. And then it was left open to each state, since states manage their child welfare systems, to decide whether they would want to extend services and in what ways in that, to the age of 23 and under what conditions. But it was not mandated that states have to do this. It's up to us, to states, and to decide what they want to do. And that there would be funding available should they wish to do so. And we got to see a whole bunch of longitudinal data following youth in 3 different states that had 3 different ways of implementing this. One, implementing it to the age of 23 with their own unique characteristics. Sometimes it may be like youth will need to continue to be enrolled in schooling or employment training. They may still need to be, involved in some kind of child welfare programming. There's going to be some kind of monitoring and expectations in order to be able to access this support. Another state extended to 21, and another that kept the age of exit to 18. And these youth have been followed now since that time. And so we have pretty good data on kind of the outcomes for youth in the ways states have put this in differently. So speaking specifically about the foster care system in Maine, just our structure here, this is really kind of simplistic, but just making sure that we all know that the foster care system in Maine is managed by the Department of Health and Human Services, DHHS, more specifically the Office of Child and Family Services, OCFS. And they, support Maine's children and families by regulating child care facilities and providers, assisting Maine families in accessing and paying for child care, and administering Maine's child welfare system, overseeing fostering and adoption services, facilitating access to child behavioral health services. And so when we talk about who is managing all of this and directing it in Maine, it is the Office of Child and Family Services. All right, so getting into the demographics, which I have a lot of, so I'll go through them as quickly as I can, because I think this is what gives us a really good picture. And there's a lot of demographics to pay attention to. And I knew I put way too much in here to go over, as I normally do. Give me 45 minutes and I want to cram in 5 hours. So there are over 391,000 children and youth in foster care. Mental and behavioral health is the largest unmet health need for these children and teens. Up to 80% of children in foster care have significant mental health issues, compared with approximately 18 to 22% of the general population. Because of the complex traumas faced by children and youth in foster care alumni experience post-traumatic stress disorder at a rate nearly 5 times higher than that of the general adult population. Youth in foster care are prescribed, again, you already heard this in the previous news article, but I'm going to repeat it. Youth in foster care are prescribed psychotropic medications at a much higher rate, ranging from 13 to 52% more than youth in the general population, who are prescribed generally at 4%. And so this is really painting the picture of the mental health needs of youth in foster care. So just the numbers at a glance, good thing, since this is something administered by the government, we do get quite a bit publicly available data on this, which is kind of nice too. So number of youth in foster care, we can see like over the past several years, it's generally going down, but we see this trend kind of go back and forth. It goes down and up. And so we can see where we're at 391,000. So median age across all of the United States, mean is around 8 years old, median is around 7 years old. Unfortunately, in this data collection, they only collect data on administrative sex and not gender identity. And so I don't know how useful that kind of statistic is without asking about gender identity. Hopefully one day we will get there that we collect that kind of data so we can have an accurate portrayal of how folks are identifying and what is the breakdown in terms of gender and sexuality of youth in foster care, because that's something else we don't collect statistics on is on sexual orientation. So we just don't know. We have estimates though. And so most recent placement settings for youth, so you can kind of get to see where youth are, is that, most youth are in what we call kind of a foster family home. So, people who go through the training and get licensed as foster caregivers. And so being a non-relative who are, opening up their homes to children, and kinship care is the bulk of it. But other than that, we have group homes, institutions, supervised independent living, runaway, and trial home visits. And then, so what is the common most treatment or case plan for these youth? And it is reunification with parents or primary caregivers, which is the goal for over half of youth in foster care. And then the next primary one would be, working towards an appropriate adoptive situation. So breaking this down in what are the racial and ethnic demographics for youth in foster care. And so, we see that Black or African American youth make up 22% of youth in foster care at this time. Youth who identify as Latino or Hispanic are making up about 22%, and youth who identify as white are making up 43%. And then we see the breakdown here otherwise. The time in care, so this is meant to be a temporary situation. So youth are generally spending about 21 months right now in a foster placement. And then we see, the bulk of youth are, under that 21 months or so. But to put this into context, so comparing this with the general US population. So according to the US Census Bureau population estimates for July 1st of 2022, the population of the United States for folks who identify as white and not Hispanic or Latino is 58.9%. And youth in foster care, that would be 43%. So general population of Americans who identify as Black or African American is 13.6%, while youth in foster care, that's represented at 22%. American Indian and Alaska Native, general population 1.3, youth in foster care 2%. Hispanic or Latino, general population 19.1%, foster care 22%. Two or more races, 3%, foster care, 8%. So we definitely see racial and ethnic disparities between the general US population and the youth who are in foster care. Moving on with, the circumstances associated with children's removal. So we see neglect is the highest reason for removal, followed by drug abuse, followed by caretaker inability to cope, physical abuse, lack of housing. And so majority bulk of reasons for removal are around neglect. And then again, reason for discharge, 47% are being reunified, and then 25% are adopting, 9% emancipate, which means they have exited out of foster care at a legal age of 18 or older. And then, so the bulk are being reunified or adopted. All right. So Speaking of youth emancipating, which again is aging out of the foster care system, so approximately 20,000 youth age out of foster care every year. This has remained relatively static um, over many years. That is around anywhere from 5 to 10% of youth in foster care are aging out. So researchers have found that between 31% and 46% of youth exiting foster care experience homelessness by the age of 26. The risk of homelessness was particularly acute for Black youth exiting foster care and for parenting youth. An estimated 20% of young adults who are in care become homeless the moment they are emancipated at the age of 18. So these are youth who are losing their primary caregiver, which is the government, and exiting care directly into homelessness. And so nationwide, 50% of the homeless population has spent time in foster care. And then on average, 1 out of every 4 youth in foster care will become homeless within 4 years of aging out of foster care. And so while 20,000, is compared to a general population, a small number of folks, this is really dire circumstances for youth who are aging out of foster care, that there are not good outcomes. And so on to kind of the experiences of LGBTQ plus young care or people. So LGBTQ plus young people are overrepresented in foster care. A 2019 study found that 30.4% of youth in foster care identify as LGBTQ plus and 5% as transgender, compared to 11% and 1.17% of youth not in foster care. And so while many LGBTQ youth enter the child welfare system for the same reasons as non-LGBTQ youth, 44% of LGBTQ youth in state custody report they were removed, ran away, or were thrown out of their home for reasons directly related to their identity. And it is estimated that 40% of homeless youth identify as LGBTQ. So we see further disparities around sexual orientation and LGBTQ youth in foster care. And then lastly on this is kind of like socioeconomic status of youth in foster care is difficult to determine because this isn't collected. But studies suggest that foster children have a higher odds of living in poverty than other children. But this is just accounted for by their caregivers' demographic characteristics. One would need to consider the increased surveillance of people living in poverty, such as contact with mandated reporters through over-policing and reliance on social safety nets. So Maine, here we are. Maine, we have, for 2021, the last time these statistics were published, over 4,000 report or child maltreatment victims, an entry rate of 3.6% into foster care, having slightly over 2,000 kids in care, and then 339 adopted. Racial breakdown of the youth in Maine. We see again 64% identify as white, 25% notable as missing data. But here's where it really comes in is comparison, going back to the census. So Maine, we have a population of 90.2% of folks who identify as white, while foster care is 64%. Black or African American, 2% here in Maine, foster care 1.5, American Indian, Alaska Native, here you go, 0.7, 0.5, Hispanic or Latino, 2.1, foster care 3, and then 2 or more races, 2%, foster care 4.9, and then missing data of 29, 5%. So don't know what to make of that. So again, we see kind of racial and ethnic disparities between general population and the youth in foster care here in Maine. Again, reflective again of the national data is the reason, same reasons why children are entering foster care. So quickly went over all those demographics to give us a picture of what's going on. So thinking about that and how psychologists roll in the foster care system. So as psychologists, we are experts around assessment and intervention. And so considering that there are higher rates of PTSD for foster youth compared with the general population, again, 5 times higher, what is the role of psychologists in kind of treating and being aware of how folks are impacted by trauma? A reminder that up to 80% of children in foster care have significant mental health issues compared to that smaller percentage in the general population. There are inconsistent and inadequate access to mental health services, and the overprescription of psychotropic medications is likely to lead to some children carrying multiple diagnoses and or misdiagnosed, potentially resulting in some combination of diagnoses that fail to acknowledge the role of trauma, treatment plans and interventions that may not be matched to underlying symptoms, biopsychosocial legal factors, and trauma-related needs. um, Foster parents and others having an inappropriate understanding and expectations of the child, and poor treatment outcomes. And so the use of assessment to identify the impact to the child and aid in the creation of an appropriate treatment plan and connection to the needed resources and supports is something that I believe psychologists have a role in and can provide support in, to be able to, like a lot of frontline employees or agencies may, for example, in the case of trauma, use trauma screeners. However, it's really the role of psychologists who have the training and expertise in the realm of assessment to be able to identify that impact to the child. Not only have they had these experiences or encounters with traumatic situations, but what is the impact? Being able to go deeper and more holistically with this to create that appropriate treatment plan. And then youth in foster care are more likely to experience inconsistencies and disruptions in relationships. So caregivers, schools, caseworkers, communities. So the role of psychological theory on the importance of safe and secure environments and relationships, and on building resilience and proactive measures to enhance long-term well-being when youth are encountering multiple experiences of trauma. So thinking of the ACEs outcome and how can we kind of be proactive around that to build resilience for youth. And that's something I think psychological theory and our experience as psychologists, we can bring to how to address these long-standing issues. So quickly, mental health disparities, again, not looking good. Post-traumatic stress disorder, I've already hit upon this. We can see that for all of these, that the experiences of youth in foster care is higher than that of general adult population. So this is a population that really needs attention when it comes to mental health. And so again, thinking about our role, gosh, 2 minutes. I'll do it in 2 minutes. So just advocacy and calling attention to the system's inherent bias, working on collaboration between psychologists and other professionals, supporting agencies and caseworkers with our education, training, and increasing access to mental health care. Also for the child welfare professionals who need access to mental health care. Increase access to mental health care for youth in foster care and ongoing support for those who have exited care. In Maine here, all youth in foster care have Maine care. Enhance diversity and the inclusion of people with personal experiences of the foster care system in the field of psychology. So how can we, streamline or create opportunities for youth with these experiences to become psychologists and be a part of the field? And then work towards increasing compensation and support for those who work directly with youth in foster care. Integrate further education and training on child welfare systems into our clinical psychology programs and create processes to increase the number of psychologists who work in the child welfare settings. For example, providing scholarships for paid tuition should you decide to go and work in the child welfare system post-graduation from a clinical psychology program may encourage folks to go in that direction. Provide support for the continuation of services and relationships when youth exit foster care. And then this would be just a model for increasing access to care. A program that's been around for 30 years is a home within. They recruit and train licensed therapists who provide free weekly one-to-one therapy for youth in foster care for as long as it takes. And there's currently 20 chapters across 11 states. The end. Thank you all. I know I pack a lot in. I just can't help myself. Lucky you didn't give me 3 hours, but I know I ran out of time for questions, but please, if anything does come up, and I know, just email me and I would gladly welcome an ongoing dialogue. But with 60 seconds, questions, comments, concerns?
Good job.
Thank you.
Thank you so much, Ryan. This was great.
Oh, you're welcome. Hey, stop scaring my screen. I don't know how to. That's the level of my Zoom.
Yeah, you're fine. It'll stop when we all leave.
All right, sounds good.